Good evening, everyone. Welcome to our Facebook Live session. My name is Gary, and I will be your host for tonight's live session. So, 365 Live, right now, where you are, is a platform where we educate the public on cancer and encourage a cancer prevention lifestyle. So, whenever you see our logo, this 365 Live logo, you will know that the 365 Cancer Prevention Society is currently having a live broadcast. So, with that said, tonight, this evening is specially brought to you by 365 Cancer Prevention Society and co organized by our esteemed medical partner, Farrer Park Hospital. So, 365 Cancer Prevention Society was founded in 2003 as a social service agency, and it does have an IPC status, and we are a full fledged member of the NCSS. So, the Society's mission is to serve the community through holistic cancer prevention measures. And this is accomplished through a lot of different ways, from health and nutrition education, from promoting a healthy lifestyle, and of course, our lymphatic detox exercises. We also provide practical and emotional support and care for our members and their family members in their battle against cancer through our residential and hospital visitation, counseling, nutrition consultation, and wellness services. So please take a moment right now to like and share and follow us on all our social media pages and keep in touch with us for the latest updates and on our events and activities, exactly like this one this evening. And I want to take this opportunity to thank our co-organizer, Farrer Park Hospital. Please do check out their website, their Facebook page, and follow them, because without them, tonight would not be possible. Okay, now before we begin our talk, please note that all the information shared at this event by the speaker and 365 CPS are for general information only, and it can be subject to changes. So if you need personalized and detailed medical advice, please do consult your treating doctor. And on the odd occasion, due to the nature of some of these talks, there could be some graphic images shown in the presentation. So just please be advised. I don't think so for this one though. Okay, great. So this evening, why you're here tonight is about nutrition. And as we might already know, good nutrition is important for all people. All humans could do with good nutrition, but especially people with cancer, because if you can eat well before your cancer treatment or while undergoing the treatment, it can help you to improve your treatment tolerance and, of course, reduce the risk of adverse treatment and side effects as well. So this evening, we have the pleasure of hearing from our invited speaker, who has a postgraduate diploma in dietetics and a bachelor degree of applied science food science, and has also over 10 years of work experience as a clinical dietitian and 2 years experience as a food service dietitian. Because of all of that, we have asked her to come this evening, and for you guys to be here this Saturday evening. It is my absolute pleasure this evening to introduce our speaker, Chai Ling. So please make her feel welcome.
Hello, Gary. Hi, everyone.
Hey, Chai Ling, thank you so much for joining us this evening and for agreeing to share all of your knowledge with all of us here this evening.
Yeah, actually, I'm quite excited to share with you, which is something that related today that I'm going to share about the nutrition and cancer treatments as well.
Yeah, so is it true? Because I mean, I know from some of my clients as well that there are side effects from treatment, and that's quite common. So can this really be helped by what we eat?
Yes, basically, it will be good to share. I mean, to have the good nutrition during the cancer treatments as well to reduce the side effect. And not only that, it will be good even if you optimize your nutrition before the treatments, and which will actually bring you a better outcome during and after the treatment as well.
Awesome, fantastic. And just one other last little question. Everybody could do with better nutrition. So the principles and the ideas that you're sharing, even for people going through cancer, could somebody like a caregiver or somebody else who's participating and here with us tonight, could they personally benefit from the nutrition advice that you're giving as well, just by sort of following maybe some of the principles that you're sharing?
Yes, definitely. It's actually for caregiver, you are playing an important role to always offer your gentle support, not only emotionally, but also physically, as well as to keep your loved one accompanied, to tell them that they are not alone in this journey.
Yeah, definitely. Okay, thank you so much. So you heard from Charlie. Everybody, whether you're a caregiver or whether you're a survivor or whether you're currently undergoing the process of fighting against cancer, please take some notes. And by the way, there is comment section, so do write any questions that you might have in the comments in the chat, please. We will get to them later. And right now, I look forward to hearing from Chai Ling. So without further ado, please take it away, Chai Ling.
Yes, hi. Okay, thank you very much, Gary. So without further delay, I'm going to bring you through my slides, and I hope it will be beneficial next 30-minute sections for you this evening. Please allow me a while to upload my slides. Okay, so the topic for sharing today is good nutrition during cancer treatment. Good nutrition is actually very important for people with cancer. So by eating well before cancer, by eating well before cancer and during treatment will help to heal and recover faster. Maintain your body weight as well as to preserve your lean body mass. Eating well also help you to tolerate treatment better, especially to alleviate symptoms from side effects. At the same time, it helps to lower the risk of infections, give you strength and energy for you to feel better in overall. How treatment can affect your eating? If the person is on chemotherapy, it may cause side effects on your eating and digestion. And if more than one anti-cancer drug is given, there will be more side effects. For example, nausea, vomiting, decrease in appetite. Some may feel early satiety, experience diarrhea, constipation, or even changes in taste or smell. If the person receives treatment from radiotherapy, the treatments actually kills both cancer and healthy cells. Depends on part of the body that is being treated, the total dose of radiations, and how it is given. For example, if the RT is given to any part of digestive system, it may lead to side effects that cause nutrition-related problems. And if it is to the head and neck area, you may have difficulty or pain on swallowing, taste changes, dry mouth, thick saliva, or the pain in the mouth or throat. If the RT is to the chest, you may have difficulty with swallowing and esophageal reflux. Whereas if to the stomach, abdominal area, or pelvis, you may experience nausea and vomiting, diarrhea, cramps, and bloating. Patients who have side effects from chemotherapy and or RT may not be able to eat normally to get all the nutrients they need to restore their energy, immunity, and healthy blood counts between the treatments. So, how are you going to prepare yourself for the treatment? First, keep a positive attitude, manage your feeling, be well informed about your cancer and treatment, which will make you feel more in control. The main goal is to try to keep your weight constant by taking a balanced diet. However, if you are underweight, try to aim to push your weight up close or within the healthy body weight range. Talk to your healthcare providers to understand the nutrition-related side effects of treatments so that you know what to expect. So nutritional needs for cancer patients vary from person to person. And for those who are undergoing treatments, often have increased and specific nutritional needs. Your dietitian will help you with an individualized nutrition plan that is tailored to your nutritional requirements, medical conditions, and treatment needs. How will you manage the side effects through the help of nutrition? There is no way to know if you have any eating problems, and if so, how bad they will be. You may have just a few problems or none at all, as this depends on the type of cancer you have, where it is in your body, what kind of treatment you have. So, however, some common symptoms caused by cancer treatment are anorexia, constipation, diarrhea, dry mouth, early satiety, mucositis, nausea, vomiting, even swallowing difficulty, and taste changes. We are going to look into each symptoms management through nutrition one by one. If you experience anorexia, you are encouraged to eat small meals, 1 to 2 hourly, instead of 3 large meals. You can schedule regular meal and snack times to ensure you are consuming enough nutrition. You are also encouraged to choose high-calorie, high-protein food or snack choices like cheese with crackers, milkshakes, yogurt, soybean milk, soybean yogurt, soybean curd with sugar, food with full cream milks added, for example, pudding, milkshake, or any recipe with milk, and or even to consume oral nutritional supplements if needed. Additionally, you can add extra calories and proteins to food by using butter, milk powder, honey, or sugar. You can make and store small amounts of favorite food so they are readily available when you are hungry. And often eat your favorite food first and only try new food when you are feeling better. If you have constipation, it means you may be having fewer than 3 bowel movements a week, which includes trouble passing stools, hard stools, or incomplete empty bowels. And it may be caused by too little water or too little fiber in diet, or not being active, or due to the cancer treatment like chemotherapy, or even caused by certain medication, for example, painkillers. So here are some helpful tips like to eat more high fiber food, for examples, fruits, vegetables, nuts, and seeds, whole grain cereals, pasta, bread, or brown rice. Also, try to drink enough liquids, at least 8 to 10 glasses a day, to prevent gas, bloating, and to soften your stools. Your liquid can be from water, fruit juices, vegetable juices, milk, etc. In the other way, when diarrhea happens, it means you may have passing 3 or more loose or liquid stool per day. It causes food to pass through the intestine quickly that water and nutrients are not readily well absorbed by body. So you are encouraged to drink at least 8 to 10 glasses of liquid every day, which the liquid could be from water, fruit juices, broth, sport drinks, or take oral rehydration solutions prescribed by a doctor if any. The oral rehydration solutions is a mixture with water, sugar, and salt, and it helps to replace the water in the electrolytes you lost. It's also good that you are able to drink at least 1 cup of liquid after each loose bowel movement. There are something from diet which you may need to take note when you have diarrhea. For examples, to avoid oily, spicy food, very hot, or very cold liquids, or caffeine. Not to have high fiber foods or lactose-containing products. Those foods and beverage that cause gas, for examples, carbonated drinks, peas or lentils, cruciferous vegetables like broccoli, cauliflower, or cabbage. You may also need to stay away from sugar-free candies made from sugar alcohol. If you have dry mouth, it means when the saliva glands do not make enough saliva to moisture your mouth. We need saliva to help us in the progress of chewing, swallowing, tasting, and even talking. So when it is not there, all these activities will be affected. So you are encouraged to keep water to be accessible all the time to moisten your mouth. You can moisten your food with extra gravies, sauces, butter, or margarine. You may also choose to have ice chips or frozen dessert like frozen grapes or ice pop. And you may rinse your mouth before and after meals with plain water or use moisturizing mouth gel prescribed by your doctor. During the treatment, some may feel full more quickly than usual. So it is good for you to eat small and frequent meals. Try to drink liquids away from meals, not during the meal times. Fortify your meals with food that are rich in calories and protein, for example, cheese, egg, butter or margarine, yogurt, full cream milks, honey, avocado milkshake, etc. If you still have some energy, try to engage in some light physical activities for better bowel movements, which helps in better digestion also. If you experience mucositis, this can be painful and become infected or bleed, which causing difficulty in eating and or chewing and swallowing. Some helpful tips are you can cook food until soft and tender, then cut the food into small pieces, easy to chew, or blend the food. You can also add gravy, broth, or sauces to the food. Example of soft fruits that are easy to chew and swallow, like banana, papaya, watermelon, or mashed potatoes, porridge with minced meat or fish, custard and puddings, milkshake, scrambled egg or steamed egg, oatmeal, or other cooked cereals like Nestum. Some other helpful tips for mucositis are you can eat the food cool to room temperature, as hot and warm food may irritate the ulcers. Drink liquids with meals and sipping in between bites. You can even use a straw to drink liquid to prevent it from touching your sore mouth. Drink more liquids help to keep your mouth clean. There are some food which will irritate your sore mouth, like acidic citrus fruits and juices, for examples, oranges, lemons, grapefruits, spicy or salty, very hot or very cold foods and drinks. If you have the side effect of feeling nausea and vomiting, you can consult your doctor if you need any anti-nausea medications. You can also try convenient foods like takeout or pre-packaged meals to minimize the nausea symptoms while preparing your food. And if the food smell makes you nauseated, you can try cold foods like sandwiches, cereals, or crackers. You can also try letting your cooked food cool down for a few minutes before eating. You may choose small and frequent meals, as it can stop you from getting too full and allow you to take in more food throughout the day. You may need to limit high-fat foods or use lower fat in cooking methods like boiling, baking, steaming, grilling, etc. You may also try to choose a relaxing place that has a comfortable temperature and to avoid places with strong smell. You may feel better if you eat with your friends or family, as it may also help to distract you from nausea. Try to drink 8 or more cups of liquid every day if you can, and drink an additional half to 1 cup of liquid for each episode of vomiting to prevent dehydration. If you experience swallowing difficulty due to the treatments, which means you may have having trouble passing food or liquid down the throat. Some people may have the get or cough or choke when trying to swallow. Others may feel like the food is stuck in the throat. Referral to a speech therapist may be needed to evaluate the severity of your swallowing problems. They will be able to advise you on the suitable food texture, fluid consistency, and ways to swallow better. If your food or fluid required certain texture or consistency modification, your dietitian will advise you on how to prepare your food or fluids accordingly to the level tolerated or recommended to ensure you will get adequate nutrition from a texture modified diet. The texture or consistency of the food or liquid appropriate for you may change over time as it depending on your treatment intensity and recovery process. There are some tips to share on how to overcome this issue. For examples, you can eat soft, smooth, or blended foods like porridge, oats, instant cereals, yogurt pudding, mashed potato, cream soups. You can choose meal preparations like mince, braise, stew, and steam to soften your food, or even to moisten dry foods with the broth, sauce, or milk. Another side effect from the treatments may be the change of your taste. Sense of taste can be affected not only from chemotherapy, radiotherapy, but also from other medications. Changes in taste may vary from person to person, and most common changes are having bitter and metallic taste in your mouth. Sometimes food may not taste of anything to you also. So we will be looking into ways to handle indifferent taste changes. For examples, if your food seems tasteless, or if there is bitter or metallic taste in your mouth, and if the food tastes or smells different than usual. For the first sharing will be if your food seems tasteless. You may try to change the food texture or cooking methods. For examples, you may prefer fried omelette to steamed egg or vice versa. Some food may taste better in cold or at room temperature. You may choose and prepare foods that look and smell good to you. You may also use more spices and flavorings as tolerated. For example, to add sauces and condiments like soy sauce or ketchup to your food, or you may marinate your meat or meat substitutes in spices, lemon juice, or other sauces. You may use onion or garlic to flavor your vegetables or meat. You may also add herbs or spices to flavor your food. Sour foods help to stimulate your taste buds. So it can be one of the choices. So lastly, you may also try alternating your bites of different tasting food within a meal. So how you may handle if there is bitter or metallic taste in your mouth? First, you may rinse your mouth with water before meals. If meal tastes bitter, try marinating it in sauces. For example, you may squeeze lemon juice on it if your mouth is not sore. You may include meat substitutes for protein. For examples, dairy products, beans, tofu, tempeh, or eggs. You may choose to use plastic utensil to reduce the metallic taste during meals. If food tastes or smells different than usual, you may avoid foods with strong smell. For examples, if you find meat and fish have the strongest smell, try eating poultry, eggs, and dairy products. You may experience the food with different seasoning, ingredients, cooking methods, and cooking temperature. If the food tastes too sweet, you may try adding lemon juice or salt. Or if your mouth is not sore, try sour foods, examples, lemon wedges, or citrus fruits to stimulate your taste bud. Rinse your mouth before and after you eat. Drink small sips of liquid throughout your meals to rinse out the taste of the food. So during cancer treatments, your immune system may be weaker and at higher risk of infection. When this happens, it is advisable that you need to take a special care in the way you handle and prepare your food to reduce the risk of foodborne infections. Foodborne infection can be reduced by examples, avoiding the intake of food and drinks which are more likely contain infection causing organism, and always practice safe food hygiene. So, like, you can ensure all ingredients are fully cooked and piping hot. Do not eat raw vegetables like salads, raw fish or shellfish like sushi, undercooked oyster. All meat, chicken, egg, fish, etc. has to be 100% well cooked. Make sure all juices, milk products, honey are pasteurized. Consume food within 2 hours after cooking. You are not advised to consume reheated, leftover cooked food. Wash your hands, knives, cooking utensils, and countertops before and after you prepare the food. Do not use same chopping board for both raw and ready-to-eat food. To use separate chopping boards, and wash the knife with soap before and after use. Defrost the meat, chicken, and fish in the refrigerator or microwave instead of at room temperature. And never refreeze the food again, and also do not leave them sitting out. If you are struggling to achieve and maintain adequate nutritional intake, you may benefit from consuming nutritional supplements which are high in calories and protein to help achieve your nutritional goals. If you are seeing a dietitian, he or she will be able to recommend you the most suitable types if necessary, and which will be based on your nutritional needs and medical condition. After treatment, eating adequately and healthily is also important for speedy recovery. As for caregivers, you may offer gentle support. Always keep food within easy reach for your loved one whenever he or she wants to have something. Suggest your loved one to drink plenty of calorie-containing liquids when appetite is poor. Talk with him or her about ways to manage eating problems, which can help both of you feel more in control. If needed, you may also get help from other family members, friends, or related healthcare provider. So please remember, regardless before, during, or after cancer treatments, it is important to boost the nutrients in every bite and sip. And that's the end of my presentation today. And I would like to say thank you very much for your kind attention throughout this presentation. And thank you for staying with me until the end. I'm happy to answer your questions if you have any. So now I'm going to pass the time back to Mr. Gary.
Hi, Charlie. Thank you so much for your sharing this evening. Well, that's a lot of information and very detailed too. So especially I liked how you broke it down into sort of the different side effects and some symptoms that we might feel, the cancer patients might feel, and of course then how they can go about remedying that. We do have a couple of questions here. Do you have a little bit of time just to answer a couple of questions now?
Yeah, sure. My pleasure.
Yeah. And by the way, if anybody does have any questions, again, please do feel free to drop them in the chat below there, and we can help address that as well. Yeah. So the first question is, thank you for joining us from Indonesia, by the way. Our first question today is about eating soursop and soursop leaf and pineapple. Is that something that can help with cancer?
Okay, well, so this is, okay. We ever heard of soursop leaf examples to drink and shrink the tumors? Okay, so so far studies have yet to prove whether this is an effective remedy, but I think it will be good if you include just as your healthy balanced diet.
Yeah. So you can sort of have it, but maybe don't expect it to cure you. Is that what I'm hearing?
Yeah.
Yeah. Fantastic. And I think that goes for quite a few. I've heard some other people tell me about, sort of similar things, and always the comment is it might work for somebody, but it may not work for somebody else. Yeah.
Yeah. So because so far the study actually has no concrete evidence to show that. So, but I would say that it would be good to take it as a balanced diet. You don't, it's not a special remedy that it can actually prevent or to shrink the tumors and things like that.
Yeah. Okay. Thank you. So, so speaking about this, so one was soursop, that's sour. So sugar. So then is sugar and carbos, so carbohydrates in general, is that then bad for cancer? Again, people hear that, feeds the cancer cells.
Yeah, sugar is actually in the form of carbohydrates, which can be found naturally in fruits, vegetables, beans, nuts, whole grains, dairy, or even soy food as well. So yes, it has actually accompanied with the vitamins, minerals, antioxidants, phytochemicals. But there is a statement from American Cancer Society showed that added sugar increase the calories intake without providing any nutrients, but promoting obesity and elevating insulin levels, and high sugar intake may indirectly increase cancer risk. So I think it would be good to aim for fresh whole food and try to limit processed food like cakes, candies, cookies, sweetened pastry, or even the sweetened drinks as well, the sugary drinks, as to limit all types of added sugars.
So anything that's naturally occurring. So if I just sort of sum all that up, it's things that are naturally occurring within our normal fruits and vegetables and things that we might eat is okay, but we don't really want to go overboard and eat, food with added sugars. Is that what I'm hearing?
Yeah, exactly.
Yeah. Okay, cool. And so so even talking about sugar, somebody asked, can milk replace sugar? So I'm guessing that maybe instead of taking something that has something with high sugar content, maybe could they have something that's more milk based? I think that's where the question's going.
Okay, the milks can replace sugars. Basically, these are the two different nutrients. So sugars, we will say is, we look at the refined sugars is the one that we try to limit the quantity of it. And where else for milk is actually, it can be the one of the good protein sources, especially when you are doing the treatment or even for healthy eating diet as well. So you can actually include the milk. But where else, if you have the cow's milk or plant-based milk, you can actually choose the plant-based milk without sugar added as well.
Yes, that's right. Yes. There's like almond milks and soy milks and things that do have like unsweetened.
Yeah.
Okay. So, and again, just a little bit more about milk. Then, what about milk supplements? So, somebody's asking, could they take milk supplements? So, Ensure or ProSure, I think, are a couple of brands. How would you add, or would somebody add that into their diet?
Yes, basically for these, we will call nutrition supplements. So nutrition supplements is actually a complete nutrition. It can actually replace a meal as well. So, but the thing is, if you are eating healthily, if you have adequate intake from your daily diet, I don't think it's really it's a necessary food or nutrition supplements that you really have to take it. But if you do prefer to include in your daily diet, yes, you are okay to do so. But it would be good if you consult with dietitians or even your medical doctor, because if you are eating on top of what you need, the nutritional requirements, you may gain weight every day.
Yeah. So again, what I'm hearing, balanced diet. If you're eating everything else well, you probably don't need the supplementation. Maybe if you're struggling to eat, I think at the start you sort of mentioned, people who maybe lost appetite or whatever, and this gives you some nutrition, then maybe that's okay. Is that right?
Yeah.
Okay. And so somebody does say that they're unable to take, sort of all dairy products. Is that a common thing in people having cancer treatment, or is that something that you've heard of or see regularly?
Usually we will, as for the dairies, we have the lactose and without the lactose as well. So you can actually choose the non-lactose based milk. Examples like soy milk or almond milk, like Gary actually shared just now.
Yeah, exactly. Yeah. So there's other alternatives, right?
Yeah.
Okay, so we have a few now. We just sort of shift a little bit. We have a few questions more about sort of food to eat or food to avoid. So, some people have mentioned that some doctors have told them to avoid eating foods like tofu or soya. I mean, we talked about soy milk, so avoid tofu and soya, or eggs, or kiwi and bird nest. Like, is this, have you heard of this, or any sort of advice to maybe share just generally, because I know everyone's different, but generally about maybe what maybe to avoid generally? Is there such rules?
Okay, if you say tofu or soy product, I guess most of the people that have breast cancer, maybe they have the concern of it. But currently, there's no evidence to show that the natural soy food is increasing the breast cancer risk or cancer recurrence. So there's no concrete data on that. But somehow, again, whichever these are the soy food, we will prefer the whole soy food instead of the processed soy food.
How do you get
Really
whole
good.
soy food?
Yeah,
I
like
mean,
just
I assume that everything that is processed is what we get from the supermarket and the shops, right?
yeah. So for examples like tempeh, or even more processed compared
so
to
tempeh.
the tau gua or tofu bean curd.
So sorry. So which one should we have? We should have the more tofu bean curd. Is that what you're saying?
It could be also something like added with the processed, like okay, the things, okay, tempeh, or it can be also for soybean milk. Yeah. So those with the naturals, more to the natural way of doing and producing the food would be more safe.
Will be more safe. Okay. And so again, talking about more about food. So if somebody were to go out to eat, I'm guessing that question was maybe more targeted at eating in sort of like food courts and hawker centers and things like that. Is that okay? I mean, that kind of prepared food.
Okay, as for the cancer patients, we will be take note of the food safety issue. So let's say chicken rice or maybe roasted duck, that kind of the food choices may not be suitable for this group of patients. And let's say the mixed rice though, so it may not be the good choices. They actually can go ahead to look for those cook on the spot and eat on the spot. So examples, noodle soup. Yeah. So it will be the
That
better
would be
choice.
better.
Yeah.
Okay, great. And you mentioned about chicken rice before. So there was a question about chicken. Chickens, especially as you mentioned before, sort of breast cancer. Sometimes people talk about the estrogen in the soy products and things like that. So what about eating chicken? Because chicken has the hormones as well. So is that an issue?
For this, Singapore government actually has a strict control on every import chicken. So I'm not so worried about this category because has been really assessed and already been qualified by Singapore government food safety.
Okay, so that shouldn't be an issue, generally speaking, yeah?
Yeah.
Okay, thank you. And what about then the essence of chicken, like for energy? Is that something worth, these sort of tonics and things, is that worth doing?
Something like essence chickens or bird nest. If you still have this, I wouldn't say they contain much nutrients, but if you have more appetite to drink it, I mean, it's no harm, but you don't take it as the main nutrient source for proteins or whatsoever.
Okay, yeah, that's a good point. So a lot of things that we could take are more supplemental, they're nice to have, but don't rely on that as your nutrition. Yeah.
Yeah.
Okay. And so again, more on this tonic. So tonic or herbal remedies and maybe herbal concoctions and things like that. For the person who asked this, hi Sharon. The next session, the next Facebook Live is going to be talking about traditional TCM. So that question may also be valuable, and you may want to tune into that next 7th of Jan as well. But Chai-Ling, because we have you here right now, what do you think about sort of tonics and again herbal remedies, herbal stuff during sort of chemo or during the radiation therapies?
I guess this is a very common question, whether you can have the herbals during the treatments or not. But I would say majority of your medical doctor actually, they are not keen for you to have any herbal supplements or even your herbal remedies, because they actually will have interfered with the treatments, the medications that you are taking as well. So it's good that you always consult your medical doctor. Is it suitable for you to have all these herbal supplements or remedy, and is there any contraindications for what you're having now?
Yeah, exactly. And I think that goes to supplements as well, right? There's going to be some specific supplements that people could take that, again, have either an interaction with or changes how the treatment or the medications you're taking works as well, yeah?
Yeah, so examples like antioxidant supplements. So it is actually like it will also create it will create the free radicals. I mean, it is not that recommended at this time due to the possible interference with treatments. So treatments actually creates the free radicals by damaging the cancer cell, and antioxidant supplements may reduce this action by preserving the cell. So it's a bit conflict. So, but where else the medical journal has no concrete data or the evidence to show that antioxidant supplements alone help to prevent cancer. But however, if you go along with a healthy lifestyle or balanced diet, can help to lower the chances of developing certain cancer. Again, always good to consult your doctor. So if it is suitable for you to have any supplements or not.
Yeah, definitely. Okay, so everybody heard that, right? So you can take a lot of things. Please consult, get detailed and personalized medical advice from your treating physicians. So we just move a little bit from the tonics and that sort of thing to green tea. Any contraindications or indications for people with cancer to have green tea? I mean, I personally know a friend of mine, apparently her colleague, they called self-cured cancer with green tea, and I was kind of like, okay, wow, that's great, but don't go and tell everybody, because if everybody foregoes treatment for green tea, I don't know if that's going to be a good outcome. So any insights from a dietitian's perspective?
Okay, if you drink it as a normal consumption, about 1-2 cups or max 3 cups a day, I guess it will be you can treat it like just normal drinks, normal hydration fluids for you. But where else, yes, everybody knows that green tea has the antioxidants somehow. But again, there is no concrete data to show that it will prevent the cancer or it will shrink the tumor somehow. So, and just in case, for example, for the people that have low hemoglobin or low iron, so actually we try to restrict the green tea or even the caffeine or coffee because of the chemical component, you will interact with the iron absorption in the body as well. So I would say for normal consumption, just 1 or 2 cups a day should be fine.
Okay, great. And so again, just talking about more drinks than 100 plus, and carbonated drinks and that sort of thing. Any indications as to whether can't, how much it's okay, so long as it's moderated?
Okay, so let's say if you have like the sharing just now that I shared about, if you are facing diarrhea, so it is actually a good source for you to have these sport drinks. So not only 100 plus, but any other sport drinks, because it will help you to rehydrate yourself with the electrolytes that you need for your body. But again, it's not saying that you have to drink it every day.
Yeah, definitely. And so with that, if people do have sort of a stomach upset, so IBS, so irritable bowel syndrome, any acid reflux, is there anything that they should avoid, or maybe food they should eat to help that? So upset stomachs and that sort of thing as well.
Okay, so IBS, actually we have the IBS diet as well. So it's quite different compared to regular diet. If you are consulting a dietitian, so I guess the dietitian will give you a different meal plan for you, individualized. So where else for gastric reflux? So gastric reflux, actually, the most important thing is not to eat so oily food, and be careful of the spicy, be careful of the caffeinated drinks, carbonated drinks, and try to not to lie down immediately after your meal. It helps a lot. And also to sit upright after at least half an hour to 1 hour after your meal.
And by the way, we should all sit upright anyway. It's good posture to have, and saves your neck and saves your back problems as well. So everybody sit up tall anyway. But yes, definitely don't lie down after a meal. And I know some of my clients have gastric stuff, and no coffees, no caffeine. Yeah, that definitely helps as well. Thank you. So we're going to jump back to carbohydrates again. That seems to be the talk of the town in the chats here. A couple of quick questions. Low carb, no carb diets, any validity to this, or what could people do with regards to taking or not taking carbs?
We, for American Dietetic Association, still recommend the moderate intake of carbohydrates, which is about 50 to 60%. So for the low carbs or no carbs diet, there will be some medical issue that we have to take into considerations. So it's not that unless you have actually consult your medical doctor, which your current medical condition is okay for you to go ahead with the low or no carbs diet.
Okay. And also with carbs, I mean, does it matter brown rice or white rice? Like, would that make any difference?
If you have if you don't have much of the stomach upset issue, so you can actually go ahead with the whole grains or brown rice products. So where else for if you are talking about the diabetes or blood sugar issue, so it will be just about the same as the sugar raise in your blood sugar. It will be a bit slower for the white rice compared to brown rice, things like that. But the amount of the carbohydrates that again in moderate intake will be about 50 to 60%.
Okay, sure. So in terms of food preparation and that sort of thing, does it make a difference whether we use light sauces or dark sauces, canned tomato pastes for cooking? Does any of that matter?
Basically, they are all sodium. Yeah. So whichever the sauces that you are using, according to your preference, your taste preference. So at this moment, because you are going through the treatment, so the most important is you can cook a food that acceptable to you. You eat as much as you can to gain the maximum, to optimize the nutrition intake as much as possible. It doesn't matter how much that you use light sauce.
Okay, sure. And so from sauces to spice, I mean, is spicy food, why do we need to avoid the spicy food? I mean, so if you have gastric issues and reflux issues, yes, avoid that, because the spice will flare that up. That's what you mentioned before. So for the other maybe cancer patients who don't have the reflux? Is spicy food still a bad thing?
It's actually okay. Yeah,
Is actually
because
okay.
some people actually like spicy food so that they can eat more. They can
So that increases their appetite, yeah?
Yes, they will increase the appetite. It helps.
Okay. And then what about durian? Is durian a good thing or not a good thing, or doesn't matter? Enjoy. Life's short.
Yeah, just enjoy. It is just a fruit. So you can just treat it as a normal, healthy, balanced diet. The 2 portion of fruits a day, yeah, it's fine. It doesn't have any concrete evidence to prevent the cancer or whatsoever.
Okay, sure. I saw one last question here about canned tuna or canned fish. That's all good as well. And by the way, for some of these questions, if we weren't able to address the question fully, or you want to ask a follow-up question to the answers, please do type them in the chat so we can get to them. Yeah. All right. So we do want to try and cover as much as we can. There are a lot of questions that have been coming, which is wonderful. But if we're not able to answer what you want to hear, or you want to clarify something, please do send it in the chat so that we can try to get on top of things as well. Yeah. But yes, sorry.
Yeah. Back to your
question. Yeah. So canned fish, canned tuna. How's that?
We have less processed canned tuna. So example, the tuna in water. Yeah, that's more close to the fresh whole tuna. So you can actually choose that. Where else you can actually choose the tuna from wet market if you want, if you prefer.
Yeah. So and I think that's the same for all how should I say, all food, and we want to start always with the most natural form first, yeah, rather than the processed forms. It's like you said, the tuna or the fish from the wet market first before something in a can. But if a can just makes life easier, sure, no problem. Yeah. And any fruits that you would recommend in particular that would be useful for people who are undergoing some cancer treatments?
So far, no, but just be careful of those. If you have the sore mouth, be careful of the citrus fruits, certain fruits that I mentioned in my slides just now. So otherwise, if you don't have any of the symptoms or any of the side effects, you can just eat any fruits that you like. But be careful of the food safety side as well. For those examples like blueberries or strawberries, that easily rotten food that may not be that suitable for you, it will be advisable that you can have the thick skin fruits. It's more safe to you.
Okay, thick skin fruits, yeah, thick skin fruits. So what about supplements like vitamin C? I know you said people with might not be able to take the citrus foods, right? And of course, citrus, most people associate straight away with vitamin C. So then vitamin C or vitamin C supplements, is that useful to take?
Okay, so vitamin C supplements, if you are taking for health maintenance, I would say not to take those very high in dosage, because usually what our recommendations daily needs is only 100 to 120 milligrams per day. So those with very concentrated vitamin C supplements, it can be 500 to 1,000 milligrams a day. So does it really worth for us to eat it every day? So which means I would say that again is related to the cancer. So far there is no concrete evidence to show that the supplements will help to prevent the cancer and so on. But again, if you choose more natural fruits, it will be better for you to get the vitamin C from compared to the vitamin C supplements.
Yeah, and so what I'm hearing maybe is also like making sure that you eat to boost your nutrition more so than eat because you think you want to cover everything because somebody said, oh, you should eat this and oh, you should eat that. So you're trying to cover everything. It's more to eat to get your nutrition to boost your health so that you can fight your cancer and not succumb to some of the side effects and symptoms that might result from the treatments as well. Is that
Yeah.
That makes sense? Yep. Okay, so a couple of last questions. Okay, I saw a question before. I can't find it right now, but there is another question about keeping. Yeah, that's right. I remember. So, can cancer patients eat fruits that have been kept in the fridge for a few days, and also reheat foods that maybe you had some dinner last night, some leftovers, stick it in the fridge, and is that a problem to sort of reheat the foods and have that as well? So fridge related.
Try not to reheat the food. It will be good for you to cook fresh and finish up at that meal, and not to leftover because of the food safety issue as well. So, and remember that your immune system is actually quite low at this period of time, so you don't get to expose of the food poisoning issue.
Okay, but fruits then, no problem if they've been sort of cut and in the fridge for a few days?
For the fruits, we will prefer you to eat it on the spot as well, not to leftover and keep it in the fridge for a few days. The bacteria actually will grow, which you may not be able to see.
Yeah, and also I think there's a lot of oxidization, right, of some of the minerals and the vitamins. My understanding, if you sort of cut and you leave it, is that just a wives' tale, or is that sort of real as well? The quality of the nutrition in the food is what I'm referring to.
The basically is more to the food safety issue.
More to the food safety issue. Okay, cool.
Yeah.
So fast food and ice cream, no problem? Or bad?
Okay. Fast food,
you're going to crush a lot of people's heart if you say no. Sorry, joking. Sorry, continue, please.
Yeah. I mean, okay. In more, realistic, because of fast food, actually, they will have a lot of the free radicals produced in the body. So, but I would say that if you are consumed in just once a month, I think it doesn't really matter, but not really to make it a habit of to eat it every week.
Okay, so again, moderation, don't overdo it.
Yeah, and ice cream is the same as well.
Ice cream's the same as well. Such a good food, ice cream. Okay, so you heard her. Moderate your ice cream intake as well. Now, somebody has a very specific question. I'm not sure if you're able to answer this. Somebody's feeling a needle prick feel on the body after chemo. Is there any suggestions on that? Have you heard of that sort of side effect or symptom post treatment? And is there anything that could be done for that sort of needle prick feeling?
I would suggest that you can talk to your medical doctor, okay, because this is something that they will need to investigate as well.
Yeah, so it's not. So that's maybe something that's happening that they need to look at the nerves or look at something else, right? That's causing that. Yeah. Okay. So, yeah, please go and check that out, and again, speak to your treating physician or whoever it might be that can help you with that. Yeah. So you mentioned about food that needs to be sort of cooked and then eaten on the spot, preferably don't reheat. So then another question, maybe a follow-up question to that is, what about cooking like a double portion and freezing the food as opposed to fridging the food? How about freezing food and then reheating?
You mean the cooked food to refreeze and to cook again?
Well, I think it's so. I think they're cooking it like maybe a larger portion, because I think maybe for some people, even for me, right, it is quite tiring to cook every single meal for every single day. So if they could cook a larger portion, stick half of it in the freezer for tomorrow or next week or whatever it is, and then because freezer, again, my layman's understanding is, well, no bacteria should be growing in the freezer. And food preserves longer. So is that better than putting it in the fridge?
You can actually put it in freezer, in the sense that because of some that you really don't have time to cook it again, but to make sure that you really have to cook reheat to 100 degrees Celsius before you eat. Not in the microwave. Not in the microwave.
So when you take the food out of the freezer, you've got to really cook it, not just stick it in the microwave and heat it up. Yeah. Okay. So everybody heard that. Cook your food again. Yeah. Take care of yourself. Make sure that everything is safe. Okay. So we've got a few more questions. We're almost out of time. Thank you so much for the questions, by the way. Okay, there was one question about lactose intolerance milk. So we shared that a little bit earlier, and the answer was there are always alternatives to dairy. So please check out some of maybe the the soy or the vegetable milks, right? So the almond or the rice or the soy or something like that, where there's no lactose. We do have okay. So a couple other questions. So we talked about brown and white rice. There's a similar question now about bread. Is it pretty much the same? Any recommendation on whether it's wholemeal or oat bread or white bread or sourdough? And if you could be really specific about the sourdough too, could the IBS patient eat sourdough bread?
Salads, raw vegetables is a no during cancer treatment. No, because of food safety issue. Yeah. So all the vegetable has to be well cooked, 100%. Where else for white or brown rice or white bread or wholemeal bread? All of us actually know that the whole grains, they have a bit more nutrients. So again, if you don't have any stomach upset issue, you can go ahead with the whole grain or brown rice or wholemeal bread. So it's actually okay. Yeah. So it doesn't matter. But the thing is, at this point of time, what we are looking at is how much that you are going to put it in your mouth. If you prefer white bread more to the brown bread, I will suggest that you eat white bread instead of wholemeal.
Yeah. So in other words, just get the nutrition and make sure you're well fed.
Yeah.
Yeah. What about sourdough bread? So sourdough bread, and especially for somebody who has IBS, is that a concern, or are they able to take that? I know it's a much more specific question.
Okay, sourdough bread. If it is not whole grains, because for IBS, unless the bread is being using other kind like gluten-free flour to make it, I think shouldn't be a problem.
Okay.
For IBS, actually, tailored to certain types of the flour that may not be able to tolerate it well.
Okay. Yeah. So again, the person who's asking about the IBS, I mean, it is a little bit more of a specific question. So please do go and speak to your treating doctor or physician or dietitian to get personalized care, please. Yeah. So this is when we run these sessions, we do want to educate, we do want to answer as many questions as possible, but please do understand that this is really educational, for educational purposes. We're not here to treat or consult or provide treatment for. That's what your treating physicians are going to be there for. So please do also follow their advice as well. Yeah. So we're going to be wrapping up really shortly. Just one more thing on two more things. So one thing on bread. We talked about bread. What about prata? Any problem eating roti prata? A favorite food over here in Singapore?
If you like prata, which actually will give you a bit more calories from there, I don't mind.
Okay, so pratas and all good. Okay, good. And then the last one is then snacks. The person who asked about snacks like chips and chocolate, sweets and desserts and cakes. We shared that a little bit earlier. You can look at Chai Ling's reaction already. Her facial reaction says it all. We did talk about sugar and not to overconsume too much sugar. So having sugar in your natural diet is great, but don't go overboard eating a lot of these processed foods. I mean, generally, even if you don't have cancer, processed foods aren't that good. They're not good for your health actually, and they've got all these added sugars, especially your desserts and cakes. So Chai Ling has actually addressed that a little bit earlier. Okay, so the last question for this evening, thank you so much for hanging back, guys. The last question is, any herbal tea recommendation for a sore throat? Again, something really specific, but if you could finish with that question, anything you have in mind for that?
Basically, it is very individual. So the herbal tea may works for you, but it may not works for the other person. So it's quite individual.
Okay.
Yeah.
Yeah, I think so too. I think so too. All right. Thank you, Charlie, for hanging around. Thank you, everybody, for hanging around. And please, audience, please do not go yet. I just have one small favor to ask, so please just hang on. But I want you first to just thank Charlie for being here this evening. So you're welcome to chuck that in the comment section. Charlie, thank you so much for your time. Thanks for answering all the questions too. We've just gone a little bit over time. I wish you a very wonderful Saturday evening and a good Sunday ahead. So
Thank you, Gary.
Not a problem.
Thank you,
Thank you so
Gary.
much.
Thank you, everyone. Yeah. Thank you.
Thank you. Alrighty, so everybody, please do not go. Please do not go. I just have a quick favor to ask. As Charlie's now taken her leave, I would love to get some feedback from you guys. So I see there's some thanks, and thank you everybody for being here. Thank you for participating this evening. We want your feedback because we want to know what we can do differently, what we can do better, what you want to know so that we can run these events and make them beneficial for you, because essentially they're not for us at all. They're just for you guys. So please, can you just take a moment right now, scan this QR code. Yep. Take out your phone, scan it right now, or screenshot your phone if you happen to be tuning in from your phone. Okay. So that you can give us your feedback shortly. Okay, thank you. And again, thank you so much for all the comments and the thanks to everybody. We are greatly appreciative of you guys being here and, of course, asking lots of questions, supporting our invited speakers as well, yeah? Okay, so next Facebook Live, that is on the 7th of January, yeah? So it is a Saturday, same time, same place, right here, 8:30 p.m., 7th of January. Please mark that in your calendars. After, not yet, after you've done the feedback, please. The speaker will be Chan Zi Hao from the Singapore Thong Chai Medical Institution. And as you can see from the screen next to me here, this session will be delivered in Mandarin. I may not be facilitating that event because my Mandarin is, but whoever is going to be magical. It's going to be a great evening, and you're going to learn how traditional Chinese medicine can help with cancer care as well. All right. Thank you all for being here this evening. My name is Gary. I've had the absolute pleasure of hosting you guys this evening. Please do check out our social media pages, Facebook, Instagram. Check out our website. Stay tuned for any upcoming events. And I look forward to seeing you guys in the future. All righty. Till then, have a Merry Christmas and a fantastic New Year ahead, yeah? Cheers.